Hi, I'm Shannon Rotolo. I'm the Pharmacy Education Coordinator here at the University of Rochester Medical Center, and I'll be talking to you today about our Scholars Program. So we are a large academic medical center, meaning that we partner with a medical school at a minimum. Here it's a medical school, a school of nursing, and a school of dentistry, and major research institution, uh, and offer specialized care that may not be available, in our case, is not available anywhere else in the region. Um, as an academic medical center, we're also upstate New York's largest biomedical research program. So all of this to say we have some pretty unique opportunities for students here in terms of different things that you'll see in different patient populations that you'll encounter. Specifically, the Strong Memorial Hospital is an over 800 bed university-owned teaching hospital, ranked number one in the region. And the Golisano Children's Hospital, which is on the same campus as our Strong Memorial Hospital, is a close to 200 bed hospital with the only level 4 NICU in the region and PICU with a cardiac care unit as a different portion of that PICU. So again, really specialized care for children in that facility. Not listed on this slide, but the third hospital that is part of that same medical center campus at the main site is the Wilmot Cancer Center, which recently also received some really specialized designations. We do have regional hospitals within our system. So just a little bit down the road is Highland Hospital, which also offers their own longitudinal APPE experience. So I encourage you to check that out if you are looking for longitudinal options this year. They also have a great program. And then we are connected to a number of other regional hospitals across the area. So the purpose of the Scholars Program specifically is to enrich the student experience throughout APPE rotations and to prepare you for a successful placement into PGY1 residency program, or perhaps fellowship, or perhaps some other career option if that's what you're most interested in. But I will say this is a really unique opportunity for students who are pursuing PGY1 residency next year. Some advantages of doing any longitudinal program are going to be reduced orientation time. So rather than having to learn a new electronic medical record system, a new organizational structure or culture at the start of each learning experience, you'll learn that once and then in further learning experiences be able to go more in depth on patients and disease state management, rather than trying to just work out those logistics. You also get to work closely with mentors on longitudinal projects. And here we offer a professional development series, meaning one of our preceptors or mentors within the system will meet with our students in the Scholars Program roughly every other month. It's a little more frequent at the start of the year, spaces out a little bit more toward the end of the year. But this is really aimed at facilitating some small group discussions to allow you to ask questions about different skills or steps to matching successfully into PGY1 residency. And again, this content is also pretty relevant for those pursuing fellowship or pursuing other career options. In terms of the overview of the program, so you would complete the majority of your APPE rotations with us at UR Medicine. We'd like you to complete all of your required rotations with us and then at least one of your electives within the system. We do like to give that flexibility, but if you're excited to do multiple electives within the system, we will find a place for those. There are opportunities for committee involvement. We do, in terms of longitudinal activities, also offer opportunities for participation in resident research projects. This is no longer a requirement of the program as this has become a little bit more student specific. So if you are a student that maybe already has a little bit of experience with research and you're looking forward to taking more of a lead, more ownership on a research project, we can partner you with a specific preceptor on a project rather than having that additional resident layer as well, so that you're able to really, again, take a little bit more lead, a little bit more ownership if you already have that background and feel comfortable diving right into a project at that level. However, there are plenty of resident research project opportunities for anyone who's looking to just get sort of a taste for what research is like, maybe do a little bit of data collection, get some basic understanding of how a project runs or what the flow of it might be. then those are great opportunities and there are plentiful options to choose from. Drug utilization reviews, most years, the group will work collaboratively on a large scale drug utilization review, but this is really as assigned based on the needs of the hospital that year. We do require a formal presentation to a system-wide audience. This is a 30-minute presentation that tends to fall in the middle of October. You will have a preceptor that you can select your topic, and your preceptor, they may give you some guidance for how to scope that topic or maybe a better, deeper question to ask. But this can be based on your area of interest, or we can help provide some suggestions if you're simply not sure where you want to look. But that presentation is really a great opportunity, and we've even had a student pursue CE accreditation for one of them. That's not required, but a fun perk that we're able to offer if your presentation is appropriate for it. And then the professional development series I already mentioned on the previous slide, but again, is a great longitudinal experience and keeps you connected to the other scholars students who will be on different learning experiences than you throughout the year, but probably having some similar overall student experiences. We have a number of ambulatory practice sites listed here. That list is not comprehensive as our ambulatory practice sort of sphere of influence continues to grow as our team of ambulatory care pharmacists continues to grow. So these are just a few of our most selected options, but we definitely have a wide variety of primary care and family medicine clinics that you could rotate through. And then in terms of community practices, we have the strong employee pharmacy, the outpatient pharmacy, and the specialty pharmacy, each of which has a unique patient population. There are also a number of specialized rotations, and you'll see these on a subsequent slide again, so I won't read them all off here, but you can see we've got a lot of variety. To be able to apply to this program, we would need your curriculum vitae, an electronic transcript. This does not need to be an official one. Please don't spend money on it. A personal statement describing your career goals, your interest in the program. We ask for a letter of recommendation. This is different from prior years. That can come from a faculty member, so perhaps one of your professors. But if you'd like to have a supervisor write that letter or someone who's precepted you previously that you kept a very strong relationship with and that knows you well as a learner, that's also an option. The school will communicate the completed application deadline for the year, and you can reach out to me for additional information about the program, but it is extremely flexible. So other than needing to complete those required rotations. So feel free to reach out if you have questions, but most things, if you can dream it up, we often are able to accommodate it. I will share these final slides just to one more time kind of summarize some of the rotation options that are available. Again, this is not necessarily comprehensive, but these are going to be the most likely to be available to fit into a standard schedule. If you're looking for something a little bit more specialized than what was on these two slides, please reach out to me, let me know what your interest is, and we can look at if that's something we can accommodate. I wish you all a lot of luck and hope to hear from you soon.